Welcome to Wert, Simpson Dental. Today we're going to go over your drug-free workplace program. This presentation is given to you by USA Mobile Drug Testing of Oklahoma. Why drug test? Drug and alcohol abuse is a serious risk to everyone's safety. Wert Simpson has the obligation to protect every employee and patient from unnecessary injury. Employees and patients have the right to be in a safe environment free from drugs and alcohol. If you have any questions pertaining to this policy, feel free to contact Dr. Peter Wert or Dr. Jamie Simpson at any time. What is prohibited? The use, possession, distribution, or sale of alcohol, drugs, or drug paraphernalia, being under the influence of drugs or alcohol, the use of drugs or alcohol that affects or adversely impairs the individual's work performance or his or her own or other safety while at the workplace, and the use of drugs or alcohol that results in a measurable presence of any controlled substance in the body that is set by this policy or others that may apply. When testing occurs. Upon you being hired at Wert Simpson, we do a pre-employment drug test. If you're ever involved in an accident while at work, we will do a drug and alcohol test then. If you're involved in any needle stick or body fluid exposure, we will also do a drug and alcohol test. We reserve the right to do any for-cause tests for anybody that is displaying behaviors that could lead us to believe that there might be a suspicion. And last, randomly. Wert Simpson does reserve the right to randomly test any and all of its employees at any time. What drugs are being tested? Marijuana, which is the most common positive result that we see through USA Mobile Drug Testing. Cocaine, amphetamines, methamphetamines, as well as ecstasy. Now, in the amphetamine category, there are some prescription medications that fall in the amphetamine category, and I'll explain later in this presentation how that works. Opiates, which is heroin and also some prescription medications. PCP, barbiturates, benzodiazepines, propoxyphene, methadone, and we will add any other drug panels to the testing process if we believe that there is a reason for concern. That includes, but is not limited to, any synthetic marijuana or synthetic methamphetamine. How do we test? In most cases, for drug tests, we will use urine, but we can also use hair and or saliva. All samples are sent to a lab for screening, and if necessary, there's a gas chromatography mass spectrometry process that's used for confirmation. Alcohol we test by using an evidential breath tester, which measures your current breath alcohol content, which is exactly equal to your blood alcohol content. And the testing process. Basically, there's a 4-step process in which the drug testing occurs. The first one being the specimen collection. That's where the collector collects the specimen used for testing, which usually is urine. The donor typically provides their specimen in a collection cup, and then witnesses the drug testing collector split the specimen into 2 separate vials, and then watches them seal the vials with tamper-evident tape, and then signs and initials off saying that they witnessed the whole chain of custody process, and that proves that there is no way that that sample could be switched or substituted with any other sample. After the specimen is collected and wrapped up, it's put in overnight shipping to the lab. At the laboratory, they do a screen test, which screens for all the drugs mentioned in the previous slide. If through the screening they see any of the drugs tested for in the screen process, then they take it for confirmation testing as a second process at the lab. If there is nothing found in the screen, then the lab goes ahead and reports it to the next step as negative. But if it goes for confirmation testing, then through the confirmation testing, we use a process called gas chromatography mass spectrometry, which is a forensic process that measures the specific levels of the substance found. If the levels are above the threshold limits that we test for, then the result will get reported in the next step as positive. If it's below those threshold levels, then it still is reported as negative. Now, we have these thresholds in place that will assure that no donor ever tests positive for just being exposed to a certain drug but not actually participating in the use of the drug. Now, after the results are tested, and the next step the laboratory reports it to the medical review officer's office. The medical review officer is a licensed physician or a doctor who is specifically trained on reviewing and resulting drug tests for occupational purposes. For all positive drug test results that the MRO office receives, they call and do an interview with the donor. In this interview, they ask the donor what prescription or over-the-counter medications the donor may have been taking. If the drugs that the employee reports support the lab results that the MRO received, and the MRO can also confirm that the prescriptions belong to the donor and are being taken as legally prescribed, then the MRO will overturn the positive result into a negative result. However, if the donor does not have an explanation that explains why the lab reported a result the way that they did, then the MRO will not overturn the result, and it will then be reported in the next step as positive. And of course, all negative results that come to the MRO get reported out as negative without ever speaking with the employee. Now, all conversations that take place between the medical review officer and the employee are completely confidential. The only thing the MRO reports out is whether the drug test was positive or negative. So the employer, in the next step, which is the final step of the drug testing process, when they receive their results, all they see is positive or negative. They are not privy to any prescription medications that are being legally taken or any health issues that an employee may have. So where are you going to be tested? The collections may occur at any medical clinic, drug testing company office, or on-site at Wert Simpson dental office. And post-accident collections will be performed as soon as feasibly possible after all immediate medical concerns have been addressed. This could be at the worksite or at a hospital or medical facility. What is a refusal to test? A refusal to test, per the Wert Simpson dental policy, refusal to test. The following items could be used to determine you refusing to test per the Wert Simpson dental policy. Refusing to submit a sample, not showing up to the collection facility in your allotted time, refusing to sign the testing forms, not cooperating with the drug test collector, not emptying your pockets or removing outer garments including hats, leaving the collection area after you are notified of the collection and before you submit your sample, getting caught with any device intended to use for an adulterant or substituting your specimen, getting caught using an adulterant or substituting a specimen, or any other behavior that represents you attempting to interrupt the collection process. Consequences of the policy violations. You do get terminated for any positive test results. Your workman's compensation claims may be denied if a positive test result or refusal to test after an accident. Termination for refusals to test. Frequently asked questions. Will any test results be reported to future employers or law enforcement? The answer to that is no. All drug testing results for Wert Simpson Dental will be used just for the employment purposes for Wert Simpson and nothing else. If you need a result sent to somebody else for any other purpose, then you would have to sign a consent form authorizing Wert Simpson to release that information. Otherwise, they will not be able to. What if you don't want to take a drug or alcohol test? Can the company make you? No, they cannot. Nobody can make you take a drug or alcohol test. It is completely voluntary. However, if you do refuse to take a test or you don't partake in the drug-free workplace program, then Wert Simpson can choose to terminate your employment. Will you test positive for drugs if you're in a room full of people doing drugs or if you breathe the smoke or fumes? No, you will not. The drug testing process does have certain levels of the drug that has to be found in your system in order for there to be a positive result. So you can have some drugs in your system and still test negative. And the reason for that is so that things like poppy seeds on bagels won't cause you to test positive for a drug test, nor will sitting in a room full of smoke of other drug users cause you to fail a drug test. Do you need to notify the collector or the company of any medications that you're taking? No, you do not need to notify the collector. The collector does not document any of that on the chain of custody form. And the reason for that is because of HIPAA violations and all that sort of stuff. But you will have the opportunity to let the medical review officer know if something were to come into play or if you needed to explain a positive result. It is a good idea to notify Dr. Wert or Dr. Simpson if you're taking any medications that are going to impair your ability to be able to do your job. And last, if you get a positive result that you believe is incorrect, can you get a retest? Yes, you can. Per the state of Oklahoma, if you do want to refute a drug test result, you believe it to be incorrect, then you have the option of asking in writing for there to be a retest of your sample. That's why we take 2 split samples in every sample that we do. The medical review officer is notified that there needs to be a retest, and they take that split sample that still is sealed in the tamper evidence seal, and they ship it off to a competing lab and have that sample retested. That retest is done at the employee's expense. However, if the result comes back negative and is different from the positive result, then Wert Simpson will take up the charges for that retest. You will be reinstated and the negative drug test result will stand. If you have any other questions or you need any further information, make sure that you read the policy in its entirety. This presentation is designed to be an overview of the policy and should not substitute you reading the entire policy. And any other questions should be directed to Dr. Peter Wert at Wert Simpson Dental.